Hi, I'm John Lustria, the Education Coordinator here at the National Museum of Civil War Medicine. You're about to see Mark Quattrock, the co-founder and director of the Blue and Gray Hospital Association, give a presentation on battlefield trauma care. But before that begins, I want to tell you a couple ways about how you can support the museum. Number one, you can like this video. And number two, you can share this video. Doing both of those things helps increase our reach and gives more people a chance to see this wonderful video. Additionally, you can support the museum and all of these video presentations we've been doing by becoming a member here at the museum. Doing so is vitally important for us in these difficult times and helps continue to support educational programming much like this. So if you can do those things for me, it would go a long way towards helping the institution. But for now, enjoy Mark Quattrock talking about battlefield trauma care.
Good morning and welcome to the we're here at the National Museum of Civil War Medicine. My name is Mark Quattrock and I'm the director of the Blue and Gray Hospital Association. We're one of the official living history groups for the museum. We've been active as a group for about 9 years. Doing both living history, and today we're doing the other part of what we do as a group, which is education. So today's virtual presentation is going to be on something that really you don't hear much about, which is trauma care in the Civil War. You hear a lot about the myths, the things like soldiers bit the bullet, and soldiers really didn't bite the bullet, or they used alcohol as a painkiller, and there was no anesthesia, and that wasn't the case at all. But certainly one of the things that did come out of the Civil War that really impacts us today is what we call trauma care. As far as how we treat soldiers out in the field, as far as basic first aid, getting to the soldier right away within a certain period of time before infection sets in. Civil War, when we talk about the Civil War really did give rise to a lot of different what we call advancements. Certainly when you talk about one of the major advancements we talk about here at the museum is the Letterman system. And we're going to talk a little bit about that today and how that impacted trauma care and the first aid kits that we're going to be going over today. But certainly one of the major advancements that came out was triage, trauma care, and how they sorted the wounded, evacuated the wounded off the field, and the use of first aid kits, because up until the Civil War, there were really no first aid kits that were being used. So these are the things that we're definitely going to talk about. So before the Civil War, when we talk about the Civil War, starting with really the French and Indian War, where, as far as in our history, and then going all the way up to the Mexican War, there was no first aid kits being used, and there was really no trauma care or sorting the wounded, or what we know today as triage, being used. Basically what happened was soldiers were put on a cart and taken back to a field hospital. What kits they did have, this is a Revolutionary War capital operating kit. This is what they used for operations, and what you're going to find is a lot of the different instruments that were used during this time period were used during the Civil War. The only difference is these were wood handles. What they used during the Civil War was ebony handles. But you're going to find that a lot of the instruments that were used were definitely the same. So they did have a capital operating kit, but as far as any kind of basic first aid, where you're bandaging, suturing, anything like that out in the field, wasn't done. So where did really trauma care begin? It began in the Napoleonic Wars with this gentleman right here. His name is Baron Dominique Jean Leray. He came up with a system what he called the ambulance. Now the ambulance is more than just a cart, putting somebody in an ambulance. It's also his system of field hospitals, the field hospital tents that he had set up. This system was so successful that not only was he a doctor, he was basically Napoleon's personal physician as well, and he was given the title of Baron because of how successful his system was, and how he took care of the wounded. Now, during the Crimean War, this really is going to have an impact on what we do here in the United States. The Crimean War was basically a war fought in the Crimea. It was a war between the British, French, and Turkey versus Russia. And they were fighting over Crimea, mainly the city of Sevastopol. And one of the things that happened during the war was the U.S. Army sent a delegation over to the Crimea to look at, how things, were being done, especially the French Army. So things they looked at were uniforms, equipment. This is where the McClellan saddle came out of. As far as George McClellan, he came up with the idea of the McClellan saddle. Now, even though doctors, medical staff didn't go, what they're going to do is they're going to read the accounts that occurred. First thing is, there were definitely doctors that wrote during the period, people like George McLeod, who wrote an account as far as on his time during the Crimean War, what he found out, as far as in the Crimea. So they're going to read a lot of the different accounts from doctors that were there in the Crimea. They're also going to look at how, things were done. One of the things that definitely we're going to look at is the way in which wounded were sorted. We're going to look primarily at the Russians and their system. And we're also going to look at first aid kits being used, especially kits being used, what we call field companions, that were being used by the British, and ambulances. We're going to look at the ambulances being used by countries like Britain and France, and how wounded were being evacuated. So this all really, really came into play. It really had an impact on us and the need, realizing that there was definitely a need to create some kind of first aid kit. Now, when we take a look at the Civil War and getting into the Civil War, there was really two primary purposes for knapsacks and cases that were used. The first is when you're talking about a battlefield setting, it's going to be basic first aid. Things like bandaging, suturing. They had different variety of sutures. We're going to go over all that. Also, when you're talking about an in-camp, when they were in camp and a battle really wasn't occurring, they were in a static camp. One of the things was sick call. So this is a picture from the gallery, one of the galleries. It's our camp life exhibit here at the National Museum of Civil War Medicine. What you have is you have an assistant surgeon. You have soldiers coming up to the assistant surgeon. This is sick call. Basically, the first sergeant of every company, at a certain time in the morning, what they do is they would round up the people that were reporting sick, and then each company would report to the assistant surgeon of the regiment. And then his responsibility was, of course, taking care of the sick, prescribing, whether it be prescribing medication. So this, as far as over the shoulder bags or even the hospital knapsacks, they could just take it, throw it over their shoulder, and go from place to place, in camp to treat the sick. And really disease, when we talk about disease was the #1 killer of soldiers. We have to remember that. That when we talk about battlefield, certainly soldiers died from battlefield wounds, but more are going to die from disease, dysentery, diarrhea, and typhoid. So when we talk about triage and trauma, we really have to talk about the Letterman Plan. And that's one of the things we really stress here at the National, with the Blue and Gray Hospital Association and the National Museum of Civil War Medicine. And the Letterman Plan really had several different components. First of all, was creating a system of supply depots close to the front. Before the Letterman Plan, when the war really began, as far as in 1861, up until about August of 1862, there was really no organized system of supply. There was really no organized ambulance corps. The ambulance corps was all run by the quartermaster department. You had regimental hospitals, field hospitals. So if you were not a member of my regiment, what I would do is basically tell you, go find your own regimental surgeon. So some surgeons were overworked and some were underworked. You had no chain of evacuation, as far as how you evacuated wounded off the field. And that was really, really important. So for the first 2 years, it was really chaotic. Both sides, as far as especially with the North, even though they had a U.S. Army medical department at the beginning of the war, they were not organized for the large number of people that were being recruited and the large number of casualties that were occurring in these battles early on. So in April of 1862, you're going to have the Surgeon General, new Surgeon General, his name is William Hammond, and he's going to appoint a new medical director of the Army of the Potomac. His name is Jonathan Letterman. And he comes up with a new plan. And the plan first is, now we're going to have a system of supply depots close to the front. You're going to have an organized ambulance corps, trained stretcher bearers that are going to be designated by a green arm patch and also a green band around their cap. It's not going to be run by the quartermaster department, it's going to be run by the medical department. He's going to take a certain number of surgeons and he's going to designate them as administration. So for every corps, you have a medical director, and underneath him you have a certain number of people that would handle the administration of paperwork. Things like making sure that the hospital was supplied properly, all the supplies, that definitely was important. The best surgeons, he took the best surgeons that he had and he made them operating surgeons. These were the operating surgeons. So surgeons, the myth that, well, they didn't really have any experience, they took the best, most experienced people, made them operating these. These were the guys that were going to do the operations. And the last one is the chain of evacuation, and this is one we're going to focus on primarily. And the one we're going to focus on primarily is the field dressing station. This was usually set up about 50 to 100 yards behind the lines. Then, once wounded were evacuated off, as far as those that needed an operation, you'd have a field hospital. Now, when the system started, they had started a system of brigade hospitals. By the time you get to Fredericksburg and even Gettysburg and beyond, they're going to be division and corps hospitals. Okay, and then the last part is these wounded, once they're operated, they're going to be evacuated to a general hospital, places like here in Frederick, Washington, D.C., or in the bigger cities, where they're going to convalesce and recover. So as I mentioned, that field dressing station, this is the primary thing we're going to focus on. This was located behind the lines, about 50 to 100 yards behind the lines. This is a scene, it's in our from the National Museum of Civil War Medicine here. This is our field dressing station gallery. What you're going to have is you have a assistant surgeon here, you have a hospital steward. Hospital steward was basically the workhorse. He was the workhorse for, in the medical department. He had a variety of different jobs, a variety of different functions. His primary job was pharmacy, as far as, prescribing, completing the medications, making the medications, or, as far as, also, he had to learn how to read and write. He had to know Latin, because a lot of the medications were in Latin. But also, when you're talking about in the field, he went out in the field with the assistant surgeon and carried some of the equipment that was out that we're going to be showing you today. Also, you're going to have a surgeon in charge, and then you're going to have an assistant surgeon. So the idea that, well, there was nobody out there that really wasn't trained, that wasn't the case. Physicians especially, they were trained. They knew a lot about anatomy. They knew a lot about the blood. They knew how to use different instruments that we're going to be using today. So they were very skilled. They did go to a medical school for about 2 years, which was all lecture and book learning. But by the time when we talk about a battle like Gettysburg, these guys are going to be experienced. They've been through, somebody who's been through several battles is going to know exactly what they're doing. So when you're at a field dressing station, you're going to be basically doing two things. First is basic first aid. Anybody that had a minor wound, we're going to stitch them, suture them up. If something required suturing, we're going to bandage them, and they're going to go right back out in the field again. Also, we're going to be sorting the wounded. And the same way that the wounded were sorted is the same way we're using as far as today when we talk about triage. Different categories. So you have slightly wounded. These are the ones that are just basically minor wounds, something that you can suture up, bandage up, and then use back out in the field again. Somebody that's a moderate, requires maybe a minor surgery. They're going to go back to a field hospital. The ones that are severely wounded, especially when you're talking about bullet wounds, something that requires an amputation, they're also going to be sent back to a field hospital as well. And then those are considered to be mortal wounds. These are the wounds that you have serious head, chest, or abdomen wounds. What they're going to do is basically find a tree. They're going to call it the dying tree. They're going to put them underneath the tree. They're going to give them enough morphine or opium, make them feel comfortable, and they're going to stay there and they're going to pretty much die there. And so that's how the wounded were sorted. Today, not only are we sorting the wounded based on this, but it's all color-coded. So slightly is green, moderate. You're going to have yellow, severe is red, and then black is mortal. So today, what we use back then is the same way that we're, what we call triage today. Back then it was called sorting the wounded. So what kind of kits did they have? The first one is a kit that we have right here. Also up here now, it's called a pocket surgical kit. Now this was something carried by an assistant surgeon or a surgeon out in the field. Now they did have a different variety of pocket kits depending on the surgeon, what he felt was most important to carry out in the field. So what you're going to see is you're going to have some kits that were small, may have carried a couple of scalpels, to some kits like this, to ones even looking like this, that really carried a lot of instruments out in the field. With this kit, I can basically do everything from suturing to, you know, as far as minor surgery, you know, I can probe for a bullet, remove a bullet, and if absolutely I had to, as a last resort, I could do a small amputation out in the field, meaning I can remove a finger or a toe. Now, other instruments that he had, certainly out with him, this is a stethoscope. Back then they were using this as what's called a monaural stethoscope. By the time Civil War comes around, it wasn't widely used, but they were starting to come out with what we know today as the binaural stethoscopes, the things with the two earpieces in the ear. Basically, with this one, they were all made of wood, and you have your earpiece here. Just put this up against your ear. This is the cone part here, is the part you put up against the person's chest. And then you're listening for not just your heartbeat, you're listening for respiration. Now, one of the things they did do, and some doctors are still using this today, is what they do is take a stethoscope and then they would take a tuning fork. What they would do is strike the tuning fork, and if anybody had a broken arm or a leg, what they would do is run the tuning fork up and down the arm, listening to it at the same time with a stethoscope, and if there was any break in the sound, that's where the fracture was. Now also the vibration from the tuning fork, if you hit a part where it's fractured, you're gonna feel it. You're gonna definitely feel it. So this was their kind of version of X-ray machine, you know, when it came to trying to locate a fracture, you know, broken arm or broken leg. Now they had a lot of other instruments. This is a nasal speculum that you see here. This is a percussor. You thump this in the person's chest, you're listening to respiration. You have an ophthalmoscope. Okay, this is what you check the back of your retina as far as your eye. You have a reflex hammer. This is, believe it or not, it's a tongue depressor. So you're going to put it on the end of your tongue, pull down on it, looking back at the throat. This is an otoscope. This is to check your ear, the inside of your ear. Now, one of the things, believe it or not, that they were doing during the Civil War, and this was really common at this time, is tracheostomies. What we mean by tracheostomies is if your airway is blocked, what they'll do is there's a part called the trachea that they're going to open that up and insert this tube on the inside. And then these little things here, what they're going to do is put a string through and tie the end so that it's in place. This was very common, and as a matter of fact, about the 1850s, the British and the French were even experimenting using a tracheostomy tube with applying anesthesia, administering anesthesia. So these were some of the tools that definitely they had available, you know, when it came to diagnosing and as far as treating wounding as far as pocket surgical kits. So what the first aid kit in U.S. history, U.S. American history, was in 1859. The design came out in 1859. The kits that came out at that time were all made of wicker. And what they found was, so in 1861, when the war started, they were using these wicker knapsacks. And what they found was they really didn't hold up very well because of the fact that the frame of the knapsack was made of wicker. So then they came up with the next one. And in 1862, 1862 was really a banner year because two things are going to come out. First is the McAvoy knapsack. And this right here is the McAvoy. Basically a backpack like this. What they basically did was they took the same knapsack that they made out of wicker and made it out of wood so that it would be more hold up, you know, as far as being able to hold up longer out in the field. You're going to have straps in the back to go over the go over your back. You're going to have a top lid here, and the top lid is where you kept all your medications. As far as important medications, things like painkillers. So they had morphine, they had opium, alcohol. Alcohol was not used as a painkiller, it was used as a stimulant. If you were in any kind of shock, what we do is we give you a small amount of alcohol, try and bring you out of it. And they had other different drugs as well that they had in the field. Also carrying, as far as a small amount of anesthesia, and again, that was used as a last resort. Now, we don't really have a content list, but pretty much, you know, we know, pretty much, as far as what you're looking at, as far as equipment that you need out in the field. Now, also, on the side here, there's a drawer that lifts up, and these are the two drawers. So you can have Bandages. Bandages are all made out of muslin, whether either muslin or bleached muslin. You're going to have adhesive plaster, isinglass plaster. These were things used for bandaging. May carry some sutures, some needles, things like what they used for suturing was silk suture or even silver wire was being used. Pins. Also, you have medicine glass here. You're going to have what's called lint. Lint was used as an absorbent. What they would do is if you had a wound, they're going to put lint right on top of the wound, wrap it up in a bandage, and that's what they would use for as an absorbent or gauze. So this is the different, as far as what they kept in this knapsack. This was to be carried by a hospital steward, and the knapsack was designed basically to either open up on a person's back, whereas if I'm a surgeon and I'm going along, I can open this up, grab stuff while it's on the person's back, or I can take it off. You can take it off and set it on the ground and set up the station. So the next one is, in addition to the knapsack, you have what's called a field medicine case. This was, the Harris field medicine case was created by John Harris. This was also created in 1862. Now what we know is here we have a list as far as the drugs, but we don't really have a list of all the other things that were in it. So what we're certainly here is bandages. You're going to have a sponge that you have in here to administer anesthesia. You're going to have medicine glasses. You're going to certainly have your medications. They had over about 23 different medications that were used for a variety of different things. Scissors for bandaging. So you have a lot of different things, and of course tourniquets. And they had two different style of tourniquets. They had what was the primary one that you're going to see a lot of is what's called a field tourniquet, which was basically a strap. You put it over the limb, you put it through the buckle, tighten it up, applies pressure on the pressure point, or you're going to have one that's called a pettit style tourniquet, where you put it through, it's got a hand crank, so that you tighten the hand crank and that applies the pressure on the pressure point. So this is a small tourniquet. What you're going to see is you're going to definitely see larger ones. But this Harris field case was definitely important. Be carried by an assistant surgeon or assistant surgeon in a dressing station. Now this thing had one very serious drawback to it. And as you can see here, this is Brian Merrick from Merrick Custom Leather. What I did was I had him try it on just to see what it's like when you try and bend over and you're treating a wounded person and you're trying to grab stuff out of your case. Basically what it is this is the case when it's empty. Imagine when it's full like this. It's basically it's a weight that's just going to literally drag and fall down on the ground like this. There was really no way to control it. So you can put it back or maneuver it or anything to try and get it out of your way. So that was really one very serious drawback to the Harris case. So in 1863, we had another knapsack that came out. This one's on display here also at the National Museum of Civil War Medicine. This is called the Delacour knapsack. This was created by a man by the name of Joseph Delacour. He's from Camden, New Jersey. He was a chemist and a pharmacist. Decided that he wanted to create a knapsack for the U.S. Army. And this knapsack I basically call the everything but the kitchen sink knapsack because this thing carried a lot. And this one we do have a content list for. So this has everything from drugs. Now one of the drugs that was carried in here that you're not going to find, you're not going to find in a Harris case, and we certainly don't know as far as the McAvoy, was blue mass. Now basically blue mass was mercury mixed with rose essence or rose nips and chalk, blue chalk, and that's what gave it its color. It also had licorice in it, so that when you take the pill, we wanted it to taste good on the way down. At least had some kind of taste when we gave it to a soldier. But this was for things like dysentery and diarrhea. We gave it to them twice a day. As far as the blue mass, so certainly this case carried blue mass. Also alcohol. The cases that we've talked about so far, including the Delacour knapsack, one of the things you're going to find is alcohol. Things like brandy was very important. One of the things is what we call spiritus fermenti. And when we talk about the Delacour, there was another name to it, but it was basically a version of brandy that was used. You're going to have sutures. Now in here you're going to have lead sutures as well, lead wire as well. But it had a lot of different things in this. So basically they carried a lot. There was 3 drawers to the Delacorte. There was no top lid that you opened up. That was basically, you had the 3 drawers that came out on the side. The bottom drawer, let me go back here a moment. So the bottom drawer, what you're going to have is this is where you kept all your medications. And you can see the tins. So basically with the U.S. Army, they're going to use a lot of tins, especially with manufacturing and industry during the Civil War. So if you have a question of which should I use more as far as when you're doing a U.S. Army or a Union impression, should I use glass or should I use tin? You want to use tin, because certainly one of the things they definitely found with tin is it held up well in the field, didn't break compared to glass. So the bottom part is definitely going to be as far as for your medications. The middle drawer is going to be for bandages. That's where you kept all your bandage material that was in there. Things like isinglass plaster, whatever, medicine glasses, whatever, as far as the middle drawer. In the top drawer, you're going to have things like a spirit lamp. Also, you're going to have splints, what we call binding boards. Basically, there was 8 boards in there. Basically, applied up against, if you had a broken arm, you put it up against the person's arm, you wrap it up in a bandage, and it's a split. You use it as a splint. So that was the Delacorte knapsack. Now there was one that we really, I'm not sure what year this came out, but this is also here in the collections room of the National Museum of Civil War Medicine, and that's what's called a field case. Basically, field case is this is the back of the knapsack. On the front of the knapsack, you have a cover, a leather cover, opens up, and you have a drawer that actually pulls out from the middle of the knapsack. And inside this drawer here, you're going to have all your bandage material. These compartments here, this is where you're going to have all your medications in here. So this is certainly a case that came out during the Civil War. Another one was basically what they did was they took what called an enlisted man soft pack. This is a style knapsack that was used by an enlistment or an enlisted soldier in the Union Army. And basically what they did was they modified it. So instead of having a blanket roll up here, what they're going to have is a cover that goes over a tin insert. They're going to have a tin insert at the top. And then with that, and we have the tin inserts also on display here at the National Museum of Civil War Medicine. So it's something where in the bottom of the knapsack, you're going to have your bandage material, and then the top part of the knapsack is where you keep all your tins, your medicine tins. There's also another field case that was used. This was one used by a surgeon in the 10th Pennsylvania Reserve. This is also on display here. So they had a different variety of different types of first aid kits that were used. What ultimately they came out with, and the final thing they really came out with was, or I should say, they came out with medical saddlebags. Those were used too. Inside the medical saddlebag was, you kept your drugs, your medication, instruments, bandages, that kind of thing. So what everything basically came out to was the Coolidge case. This was created by medical inspector, his name was R.H. Coolidge. It was created in 1863. This was the design really that was going to eliminate all the knapsacks, the need for the knapsacks, because what they found was the knapsacks and everything else was basically too cumbersome to carry out in the field. We needed something that definitely could be used not just as for the surgeons and assistant surgeons, but the hospital stewards as well. So they came up with this. Now, the design, if you compare it to the Harris case, the design is a lot different. If you look at the front of the Coolidge case, you're going to find that it's curved, and it's designed so that it fits up against the side of the hip. As far as your hip. Now, the case too, when you look on the inside, there was basically 2 compartments on the inside. You had a lower compartment, and this is where you kept all your drugs. And what they did was they condensed the amount of drugs that they used. So instead of having all those drugs that they used in the previous kits, they narrowed everything down to 11. And what they considered to be the most essential drugs that were needed out in the field. Now also, too, you're going to have an upper compartment. And this is the upper compartment right here. This is where you kept all your bandage material. Also, you're going to have a towel, a lot of other, you're going to use isinglass plaster for bandaging. And this one we do have the contents list for. Now, one of the things that you're going to find in this, which was surprising to me, is there's no tourniquets listed on this, which was really surprising. Now, the other thing is, when it lists bandages, it doesn't list like a certain number or a certain size of bandage. Just lists, as far as how many bandages, were in there. So you're going to have lint, you're going to have spiritus fermenting. Basically, the main drugs that you're going to need, painkillers, things for hemorrhaging. These are all definitely important. Now, there are different variations of the Coolidge. Actually, different manufacturers actually produced a variation of the Coolidge case. So it's basically the same design. What you're going to find with this case is, whereas the other one didn't list tourniquets, this one does, right here. So this does list tourniquets in the list. It also breaks out the bandages as far as the different size bandages and a number for each. So this was one that was manufactured in Philadelphia. So they have definitely different variations. So when we take a look at everything that we've talked about here today as far as the different cases, the different knapsacks, they all have commonalities as far as what they all have in common. First was painkillers. Definitely had morphine. They definitely had things like paregoric. Opium was definitely popular during that time. They had a liquid derivative of opium called laudanum. That was used, it was very popular in the Victorian area in the 19th century. Now, opium had two functions that were used. It was not only used as a painkiller, also used to treat dysentery and diarrhea too, because one of the side effects of opium was constipation. And what you're going to find is, not only did it relieve pain, so they had a lot of different nicknames for dysentery and diarrhea, things like the Screamers, to, if you were in the Army in the East, as far as in the Army of the Potomac, they called them the Virginia Quick Step, or if you were in the Army of Tennessee, they called them the Tennessee Trials. So they had different nicknames for dysentery and diarrhea, but there's certainly, if you had a form of, where it was really, really painful, not only would relieve the pain, but it certainly caused constipation. Now, what we also found too is a lot of the people that had taken opium, one of the things is we didn't know what proper dosage was. We just gave them enough until they made them feel comfortable, and as more they became accustomed to it, and more that required more opium to give them that comfort level. So what you're going to find is a lot of the people that were given opium, especially because of dysentery and diarrhea, we find that these are the people that are going to wind up being drug addicts. You hear of old soldier's disease, and this is where it really comes from. Hemorrhaging, they did have things as far as to stop bleeding, prevent, as far as things like iron. Iron was definitely used. It was a popular item. So things that could cause clotting, prevent, stop hemorrhaging, that was definitely used as far as drugs. Also tourniquets, definitely had tourniquets. Different drugs for dysentery and diarrhea, where you're talking about ginger or rhubarb here, or like I said, opium being used. They definitely different drugs that were used for dysentery and diarrhea. Anesthesia. Now, what they used early on, what we're going to find is, like with the Harris case, and even with the McAvoy, is that they started out early in the war using ether. And what they found was there was a really serious drawback to ether. Number one is it's combustible. So if you're in any kind of a closed setting where there's not a lot of ventilation, you're especially at night when you're operating and you're treating somebody and you're using a lantern. The one thing you didn't want to get the lantern close to was ether because of the ether fumes, and it did cause explosion. Now the other thing too was, as far as the effectiveness of ether when it came to chloroform, and this is what with the later kits, with like the Delacour and even the Coolidge, that they've switched to using chloroform. Ether's out, chloroform's in, and what they find, and that's because of the safety. Safety with chloroform, but they found also that chloroform was much more effective, much more efficient as far as, when it comes to anesthetizing the patient. Now this anesthesia, like I said, was used as an absolute last resort, that they had to treating somebody at a field dressing station. Otherwise, if a soldier needed an operation, they were put on an ambulance and they were taken back to a field hospital. Bandaging, like I said, they had different variety of bandages, different sizes of bandages depending on the wound. Wounds, scissors and medical spoon to administer medication. They had a variety of different ways of administering medication, whether it be a liquid form, pills. A lot of the pills that were used were pre-made, and that's one of the things you're going to find with the Civil War is the boom of the pharmaceutical industry, because a lot of the pills, when we received them out in the field, were already pre-made, pre-manufactured when they came out to us in the field. Also powders, as far as sprinkling a powder on a wound. So these were the different things that were, how we administered. You had a medicine glass. A lot of these different things had medicine glasses. Let me show you what a medicine glass looks like. So a medicine glass basically looked like this. And it had different measurings on it. So as far as, when you're talking about teaspoons, how many teaspoons and how many tablespoons. And so they had different sizes of measuring glasses too. But this was, something that they definitely carried out in the field with them. And alcohol. Alcohol. Every one of these kits pretty much had alcohol in one version or another. So a lot of it brandy, hospital brandy, that was definitely being used. So what we're going to find is after the Civil War, when we talk about Civil War to modern day, now these kits are going to evolve over time. So when you're talking about things like the Spanish-American War, haversacks, or the World War I, World War II, or World War II, they're using pouches and haversacks, to when you're talking about Korea and Vietnam, these kits are definitely going to evolve over time. One of the things was I used to be a volunteer fireman. In 1985 is when I became a junior fireman, and at that time, medics were using plain old tackle boxes. So something like a fishing tackle box, this is what they use as their drug box. And the problem was, if you're trying to take somebody up and down the stairs, it's kind of cumbersome trying to take somebody up and stay on the stairs, and at the same time you're holding a gurney or holding a lift chair, trying to get somebody up and down the stairs. So what we've come back to, and we really come back full circle when it comes to our first aid kits, because now what's happening is this right here is a drug kit that's used by modern day paramedics, So we've gone back to the over-the-shoulder bags, and even the military has gone back to the knapsacks. So we're back to where we were when we started the Civil War, and what's evolved over the Civil War. So in conclusion, definitely things have, with the Civil War really is the birth of the first aid kits. And a lot of, like I said, the equipment that was used back then is still being used today. There was a fishing place, I think it was, that had they had a knapsack used for fishing, and actually resembled one of the knapsacks that was being used during the Civil War. Same design that was being used during the Civil War. So again, we've gone back really full circle to where we are today in the present day, that we now are using these things because we find that they're definitely more able to function. Things like the Coolidge case, which had a waist strap on it, as far as that you could actually maneuver it. We find that today, things like, your materials, that they're over-the-shoulder bags are being made out of the day, so they're more lightweight, not as cumbersome as the plain old tackle box. On behalf of the National Museum of Civil War Medicine and the Blue Gray Hospital Association, we thank you for viewing this presentation.